12-month financing fee, but save $250,000 a year. So over 3 years, this department will save $750,000, but only came out of pocket $250,000. Here's the proposal, and I would love to have a meeting with you to talk about it. Directors, right now, press the number 1 if you would say yes to that proposal, if it made sense and you had the budget for it. Press the number 1 right now. Directors, right now. If it made sense and you had the budget for it, and they broke it down just like that. But directors, press the number 2 if they say, we need a new machine. We just need good stuff, man. We got outdated technology, and it's just causing for people to leave us, and that's why we can't get the trays right and bioburdens down. So that's why we need $250,000. Directors, press the number 2 if you want to even look at the proposal. Watch how the same directors that said number 1, press 1, 2. With you communicating the same type of need. It's the same machine, but a different way you present it that will get you a different result if you learned how to master the numbers. And then you also show, watch this, the return on investment. Yes, it's $250,000, but over 3 years, we can pay on it monthly, and we will save $750,000. So $250,000 actually made our department $500,000 more efficient and less in cost in pay and turnover and overtime, which will make it look good for you when you send it up and you talk to your upline. Total different conversation. You have to be able to tell the why, the how, the when, what. And today we're going to talk about that on the next module. So strategies for communicating financial impact. We'll take a break after we finish this module. Then we'll finish it. I got one more exercise, then we'll finish out. And the rest of this training, we'll record it, and it'll be in the SIPS Leadership Institute for those of you that sign up to get, whatever. We'll talk about it. And it's free. SIPS Leadership Institute, to get access to this information, is free. This information, at least. So strategies for communicating financial impact. To resonate with senior leaders, Central Sterile Processing leaders must frame their department's contributions in terms of financial impact. Here's how to communicate. First, we emphasize cost savings. Can I tell y'all something? This is why so many people are cutting costs. The healthcare system as a whole was over budget $45.5 billion in operational expenses. $45.5 billion. 92% of hospital systems all across the country are looking to cut costs by 40%. How many of you all have started to see layoffs? How many of you all have started to see delays in new additions to the facility? How many of you all have been seeing proposals get pushed back? How many of you all have started to hear the health your leaders start talking about cost savings and saving money and being more efficient and being more profitable? You're hearing it all day. You're hearing it all day. Why? If you can't emphasize the cost savings, being in a department that's not a revenue driver, what are you communicating to them? Your job is to create profit. So cost savings is profit. So I want to highlight any cost reductions achieved through supply management, staff optimization, or improved workflows. So when we work with facilities, we have what we call integrated management. And our integrated management approach is to help the facilities actually eliminate cost, increase retention, and eliminate the need for outsourced travelers because you have the talent inside your organization. But can I tell you something? Most staffing companies and consulting firms, they don't want you to look good. They want you to need them. Here's an example statement. Our department reduced supply costs by 15% last quarter by streamlining inventory and reducing instrument damage, right? Right? And because we reduced supply costs by 15%, it saved this department 250, 300,000, $1 million in savings. With that savings, I would like to propose that we invest into 2 new sterilizers to increase productivity, and we will still be in profit. And with the new structure, we can see an additional 15% in cost savings if we can make this investment. Do y'all see the difference in telling that story from the lens of ROI versus passion and emotion? You can get them to move in action with adding the context of what you saved first. And I always like to say, before you ask for a big ask, how about you save? They see, if you cuss right there, you need to pray about that. Before you ask for a big ask, how about trying to save their bottom? Their bottom. All right. Well, you ask. Show yourself approved. Show yourself approved. And you will see a complete change in how people look at you. See, Melody, you must have laughed. See, Melody, you laughed. That mean you had no big, you was thinking something else now. After hold on. If y'all are not writing this part down, I don't know what to tell you. First, you emphasize cost savings. The second thing you do, you demonstrate impact on quality and risk and reduction. Quality improvement can translate to reduced costs for the organization. Example, by implementing advanced sterilization technology, we decrease equipment contamination rates by 20%, reducing the risk of surgical site infections and their associated costs. And when I looked and did research, I came to the conclusion, based on the data given to us, that we paid out $5 million or $7 million or $10 million this year alone from lawsuits relating to on-site infections. So by cutting cost by 20%, getting more efficient, what's the math? Let's say 10 million, saving 20%, that's what, 2 million. We saved the hospital $2 million just by getting 20% more efficient in this area. Do y'all see the difference in communicating? Directors, do you see the difference in communicating to your senior leadership? If you can connect what you want in a deliverable from what they're looking for, you have a higher probability of them moving faster with what you want. Everything we do in central sterile processing, to Rebecca's point, is related to a cost, but it's not revenue, it's profitability. So if I can show them by implementing these things, we can become more profitable. That will allow for them to see us now, Rebecca, as a revenue generating department. I mean, profit generating department, not a revenue generating department,